October is Breast Cancer Awareness Month. First Lady Tobeka Madiba Zuma's TMZ Foundation has joined the movement, holding a one-day concert over the weekend at the Walter Sisulu University Stadium in Umthatha. The event was used to highlight issues such as breast health, detection and treatment. Well, joining us in studio is the First Lady herself and a breast cancer survivor, Phungi Baloyi. Good to have both of you and welcome to Morning Live.
Thank you, and good morning to our viewers.
I'm so glad that we're doing this interview now because it's long overdue. We're already on the 19th of the month, and the whole month is dedicated to this. Yes. Let's first begin with you, First Lady. What is it that drew you to this cause? Why particularly breast cancer?
I think for me, it's simple. It's the leading cause of death among women in our country, in the region, and globally. So for me, it was very important that we then prioritize breast health education so that we can empower our women with the tools and the knowledge and the information on how to respond to the challenge posed by breast cancer. And I mean, breast cancer is not about states, it's about our loved ones. And our women are dying premature deaths in their productive and reproductive years. So it was very important for my foundation to ensure that we unapologetically first say we're going to pay particular focus on female cancers, to do a whole lot of things from education to ensuring that our women have access to being screened. I mean, it's a basic service to be screened, but also to ensure that when they are screened and they are diagnosed to have breast cancer, they then get onto treatment, and they must know about what treatment options are there. So breast cancer is not about just removing the breast, because it could have spread to your armpit and everywhere. And for me, it's very important for our women to know that there's radiation that's available and a whole host of other innovative ways to survive breast cancer. So we said, let's focus on the female cancers. Let's deal with breast cancer. It's claiming so many lives of our women, and they're not dying because of the disease itself. They're dying because of the lack of knowledge.
Yeah. And that's the reality. It's the education drive behind it. We're going to talk about the education drive that you as the TMZ Foundation does. But Phungi, I want to draw you into the conversation because we're basically calling you a cancer survivor, which is a hero to us. It really is. Talk to me about that moment that you found out that you were diagnosed with cancer.
Oh my word! It's like the world stood still at that moment. And at that time, I didn't have much information about cancer. So for me, it was death sentence, That's all I thought, okay, I'm dying. I've got a little boy, I've got a family that I'm raising, and this is it for me. But, because of the support that I got, I managed to get through it and say, I'm going to fight this. I met other survivors who had gone through what I had gone through, and I thought if they did it, so I can do it as well. And but that moment when the doctor tells you you've got cancer, it's surreal. It's surreal, when only after I'd finished my treatment and thinking back of what I had gone through, I think that's when I broke down to say, how did I go through this? How did I survive?
And was it breast cancer that you were diagnosed with?
It was breast cancer.
With breast cancer.
Yeah.
What was the treatment like? I mean, when you went through the treatment, that must have also been a very tough time for you.
It was. My cancer had already started moving to the lymph nodes. So they had to do, I had to start with chemo because they didn't know if it was anywhere else in the body. So I did 6 months of chemotherapy, and that was the worst of the worst. Her sitting there having that drip go in and feeling that thing running through your body. It was, I wouldn't wish that on anyone, But my doctor had told me before, we have to make you sick to make you better. So you go there knowing that it's not going to be a nice experience, but at the end of the day, you'll survive.
And you did.
And I did.
And not only did you survive, you went on to have another little baby.
Yes. Oh, yes, I did.
So you got a little 7-month-old sitting at home.
And this happened after I've gone through 5 years of hormone treatment.
Wow.
5 years of hormone treatment, and out of nowhere, this little baby came up, and I'm thinking, God, really? Yeah, you're showing off now. But
that was showing off.
Yeah, so
that's amazing.
It just really shows that there is life after breast cancer and the importance of early detection, because I don't think I would be sitting here if I hadn't detected the cancer early enough.
Yeah.
Yeah.
I mean, Madam Zuma, this is the story that we need to get across, that there are strong women that are survivors and that have their lives have continued. They've fought through the battle, and a bigger fight than this, I don't think there is. But there is life afterwards, and that's important to know.
Absolutely. I think for me, Phungi's story is an inspiration to say to women out there, you know what, let us join forces, let us fight the stigma, you know, against cancer, and breast cancer in particular, because there is life beyond diagnosis, but key is early detection. And that is why we advocate for access for our women to be screened, regardless of where they are in our country, Leanne. You know, and our focus is particularly in the rural areas where there's very little access or little access to screening services and to treatment. So that is why my foundation right now is working on securing 4 mobile screening vans, or rather trucks, to take to the rural areas to say, women, come out in your numbers, be screened. And we will be going to all over the country and screening our women, of course being linked to the local clinics where they can get their results. And also referral is very important. And I think for me, you know, there are such good stories to tell about our country that we're being you know, praised for when we go outside South Africa, to say that, you know, as South Africa, you were able to acknowledge that you are so behind in terms of getting the stats and getting the register. Cancer register. So that is why our Minister of Health said, you know what, I'm now re-engineering the primary health care, because that's where it is. And in so doing, in the districts, we're going to have specialists from your gynae, from your pediatrician, and the referrals are going to improve. But for me, as the foundation, I look at the gaps that exist in our healthcare system to say, yes, we're going to have doctors at the primary healthcare level, but there is still a gap for me that exists, and that for me is for the community health workers. Because the community health workers will bridge the gap between the Department of Health and our communities, because they're going to be working on the ground, and they are also going to be profiling the families, going from home to say, is there a person who has a chronic illness here? What can we help you with? Or how are you taking your medication? Profiling them and feeding into the Department of Health and other relevant departments like your DSD, Department of Social Development. And for me, I think that will be a huge plus in our country. And all those lessons, as the foundation, we've learned from the countries like Cuba. That's how Cuba has managed to really get the incidence so down to at least, I would say, 1% from your HIV/AIDS. It's unheard of. When I went to Cuba with the president, I said, is there a problem of HIV/AIDS? They said, what are you talking about? Our people are on treatment, they're screened, they're detected, our HCT is sound. So I think as a country, we need to go back to basics. And that is, for me, one of the basic things that we need to do. So my foundation, as far back as 2011, started working on putting together a proposal to say we need to start off with 2 provinces, the worst performing provinces, and get community health workers, at least train 9,000 per annum, and that will equate to 27,000 in 3 years, so that we bridge that gap that exists, and that would ensure that even the education is happening at grassroots, because those healthcare workers, they will have been trained and they will pass on the knowledge to the families, because it's about the families. As I said, this disease is not about the states, it's about our loved ones. So we need to empower our communities. We need to do everything in our power to be innovative enough to try and deal with the stigma, to try and deal with access, to try and deal with treatment, to create the necessary support. But over and above that, those that are now living with the disease and have been diagnosed at stage 3 or 4, they need to be put on sound palliative care treatment, that they don't die painful deaths.
I think the work you're doing is absolutely unbelievable, and thank you so much for coming in and talking to us. Phungi, thank you for sharing your story with us. Madam Zuma, I know you have a website for your foundation. Is it tmzfoundation.co.za?
Yes, it's www.tmzfoundation.co.za, and I'm also on Instagram. The handle is First Lady T Zuma, and we're also on Facebook, TMZ Foundation, Twitter at TMZ Foundation. And I must say that, you know, we just recently held a concert in Umthatha, which was a huge success, because we were able to attract even our youth. Wonderful. 40% was made up of youth, 60% people from the rural communities. And on the 31st of October, we're going to be in the Northwest, and we are hoping to have as many people from the Northwest as possible, because we identified to prioritize first those that are West performing provinces in terms of the health outcomes and the stats that we get from the Department of Health.
Thank you for joining us. Thank you so much for being with us here on October, which of course is Breast Cancer Awareness Month. I don't know about you, but wherever I turn lately, I'm just seeing photographs of ladies standing, whether they've had a double mastectomy or a single, that are posing without shirts on and just saying that, don't feel sorry for me. It's what you see that scares you, but not me. And that, I think, is a great message. Thank you. Thank you so much, ladies, for being with us. Let's take a break. We'll see you after this.